All right, what's going on, guys? Hopefully my phone don't slide off here. Got it in a pretty good spot. What I want to talk about right now is I want to talk about the VA. A lot of you know that I'm a veteran. I was active duty for 6 years. Had another 4 years in the reserves, and then I went through a house fire and basically had to get out. Which is actually a very interesting story, because the reason why I got out, because I was actually in the reserves for another year after I had my house fire, and I was burned on 50% of my body. It wasn't until a doctor, private doctor, not a VA doctor, nothing like that. This private doctor basically, and this is where we get into the emotion crap, that if you know anything about the political spectrum, you know which side I'm talking about. The one that always controls and always feels about their freaking emotions. At the time of my house fire, it's almost 10 years ago. So it happened in 2008. I was 20. I would have been 28 because it happened in April. Almost 29 years old. I got this private doctor. I go in there. I ask him the question. What do you think about me staying in the reserves? Should I stay in the military? This doctor, without even skipping a beat, says, no, I don't want you in there. So I'm looking at this guy, I'm like, wow, that's kind of interesting. He explained why. He said, your right hand is messed up to the point to where if you have to save somebody, you're not going to be able to do it, because I'm going to reach out with my right hand, which is my dominant hand, and you don't even think about it. The right hand will go out, and I'm not going to be able to catch whoever I'm trying to save if they're falling or whatever. Now, when he first told me that, when he first told me to get out, yeah, that hurt. 29 years old, and I got somebody telling me that I can't save somebody. So I'm leaving the hospital, and I'm sitting there thinking to myself, all right, does he have a valid point? Sure as shit he did. Because I started thinking about it, and I said, because he even said, he's like, if you're out there, you know, say they round you up and they want you to help on a natural disaster. He basically said, I don't want you helping me. I thought about that for a while. This is where you got to get rid of your emotions, and you have to start thinking about common freaking sense. I said, you know what? The hell with my emotions. He's freaking right. How would I be able to live with myself if I tried to save somebody and they ended up dying because of my right hand and my stubbornness to stay in the military? And that's what it would have been. It would have been stubbornness. The non-ability to look past and say, you know what? Somebody's right. He's got a point. I can't freaking do this. And I don't want to put another human being in that same position, or in that position to where they have to rely on me. Because believe it or not, the only weapon I could hold in my hand would have been a rifle. Well, in my right hand. In my left hand, I could basically hold anything I want. You know, so I actually had to learn. I do have a CCW. A lot of you people don't know what that is. That's a concealed carry. And I have to use my left hand. I cannot fit my concealed carry weapon in my right hand. Well, I can fit it. It's not gonna do me any good. Because it's going to, if you're seeing a glare, I'm sorry. because it's not going to make any freaking difference, because it's going to be very, very hard for me to pull the trigger. And if I pull the trigger, it's going to be with my middle finger, and that leaves me susceptible to the slide coming back and possibly nicking me. I don't want that. So, to get back to the main story at point, when I said I wanted to talk about the VA, this is the problem that you have with all you clowns that think you want a freaking single-payer health plan. Yeah, let's have the government come up with a single-payer health plan. They can't even take care of 8 million veterans. And you want them to take care of 330. Get your head out of your ass. And I'm sorry, I've seen socialized medicine. I spent 4 years in the United Kingdom. I've seen how it is. They had non-stop infections in that facility, in all of those hospitals. Staph infections. They were sleeping in rooms that had 8 people in it. 8! How are you supposed to get any privacy when there's 7 people surrounded by you? And guess what? If you want to see a specialist, that costs you extra money. And guess who those people are that are able to see the specialists? Oh, yeah, they're the ones that have all the money. So they don't have to put up with that socialized healthcare crap. They'll just go to a specialist, get seen in a heartbeat. So, let's talk about it for a little bit. I hope I don't stretch this long. It's going to get long. I hope you guys can stay with me on this one. So, I leave my house an hour early to get out here to Denver. There's freaking traffic everywhere. Traffic is backed up on every freaking road. I'm not using it as an excuse, because I do know, I've only been out here for almost four or 5 years. I do understand Denver traffic out here. It's a pain in the ass. No matter where you go, no matter what freaking road you're on, it's a pain in the freaking ass. So I ended up 16 minutes late to my appointment. My appointment was 8:30. I got there at about 8:45, 8:46. My appointment consisted of just getting a Synvis shot in my right knee. A shot that takes 3 minutes. They turned me away. That's your socialized health care. They turned me away. You want to know why they turned me away? Because there's no money. These doctors aren't getting paid any extra to see an extra patient or anything like that, or stretch anything out. They have no incentive to work on me. The only incentive they have, and this is what the guy said. He said, I've got appointments for 10 hours throughout the whole day, and I can't give this guy a 3-minute freaking Synvis shot. 3 minutes. That's about all it takes. Can't even get a nurse to do it. Can't even take me back. Now, I understand. I even told the ladies at the desk, look, I'll go ahead and I'll suffer because I was the one that was late. Me. That's on me. So if they couldn't get me in, okay, I have to suck it up because it was my responsibility to get out to my appointment at 8:30, not 8:45. But I want you guys to understand this. Today is February 15th. The next opening they had to give me a 3-minute shot is March 9th. Damn near a month later. I understand February is only 28 days. But a month later, just to give me a 3-minute shot. I even brought this up when I called the clinic because they actually want me to do a consultation. I had to get x-rays for them to even remotely say, okay, we'll give you the Synvis shot. My knee has not gotten any better in the past. That's what I don't, why can't you go off the last x-rays and basically look at my last x-rays and say, you know what, it's probably worse by now. Let's go ahead and give them a Synvis shot. Nope. I even called the clinic and said, why don't you have one person that comes down to the clinic that can give this shot? You want to know what they told me? They said, we have to have somebody qualified to give you that shot. and we can't supply them at the clinic. So, you can't supply them at the clinic. So you're forcing me to go to a hospital, take up another veteran's time who actually has worse knee problems than me. You can't get somebody out to the clinic Tuesdays and Thursdays all day to administer this shot. No, gotta go to the hospital. If this is the type of health care that you want, fine. You're an idiot. You truly are. The VA has one of the biggest budgets in our federal government. And they can't take care of 8 to 10 million veterans. Big budget, can't take care of 8 to 10 million. Think about that. All you freaking advocates that say, yeah, I want single-payer health plan. You want a single-payer health plan. The quality is freaking garbage. The reason why the quality is garbage is because you eliminate any freaking incentive for the doctor to bring you in. I guarantee it. If I were to call, get this, son. If I were to call a private doctor right now and say, hey, I need to get a Synvis shot, I'd be in there tomorrow. And I guarantee it, if I was late to that appointment, that doctor would have kept me in his place and said, I'm not losing money on this guy because he's going to pay me X for this Synvis shot. So he's probably going to keep me in that waiting room waiting just to get that shot. And if anything, he's probably going to say, okay, you missed your appointment. Nurse, can you give this guy this shot? And boom, boom, I'm in and out of there. And you got the gall to freaking say, I want single-payer health plan. You want single-payer health plan because you want somebody else to pay for your shit. Your bullshit. And that's what it is. I'm sick and tired of you freaking clowns saying you want single-payer health plan. This country's got it. This country's got it. I've been in the United Kingdom for 4 years. I've seen it. I know how much it costs. They got a thing out there, it's called road tax. You pay for it every 6 months. It's about, what was it? I think it was 180 pounds per vehicle. My wife and I had 2 vehicles. This is one of the things that we were non-exempt from. We had to pay 360 pounds for both vehicles. And if you don't know what the exchange rate back then was basically 2 to 1. We had to pay $720 every freaking 6 months just to put our cars on the road. That comes out to $1,420. $1,420. And you want to know what? They called it a road tax. I want you to go over to England if you ever get the chance, and I want you to tell me how good the roads are out there. If every single freaking person out there is paying for this so-called fucking road tax, pardon my language, if everybody's paying for this road tax, and you go out there and you say, wait a minute, these roads are short, they look like they've been here for freaking forever, where's all this money going? We had MODs, Ministry of Defense, civilians working on the base. I asked them that question. Why are the roads so crappy over here if you guys are paying this kind of amount for the roads? Oh, it doesn't go towards the roads. It goes towards our health care. Wow. So you made up a tax, you called it something else, and you're allocating it somewhere else. Anybody. I don't give a shit whether or not you think it's free. It's not free. It's never going to be free. Somebody has to pay for it. And when somebody has to pay for it, that means the government takes it from you. They make up some kind of crazy freaking ass tax and pass it off as something that it's not. You know, I'm sorry. When I was younger, when I was a kid, I'm listening to my parents. My parents told me when my dad got his job at the nuclear power plant, they said, healthcare. We used to be able to go to the doctor anytime we wanted, and we never had to pay a copay. Then the copay went up to $5. Then it went up to $10. Then it went up to $20. Then it went up to $50. If you clowns study history, why don't you look at the history of what it was like back in the 80s? Because guess what? It freaking worked. And then all of a sudden, now you have government involvement. Every time the government involves themselves in anything that has anything to do with spending, it increased the cost. And all you freaking clowns that think that it doesn't, pull your head out of your ass. What do you think happens when people just start giving free money to an agency that they know is guaranteed? Oh, I'm getting guaranteed money. If I'm getting guaranteed money here, I'm going to set my price way up here. Why? Because that half is guaranteed. You people that want your single payer health plan, you guys make me sick. You really do. You make me sick. Here's another. I've gone on long enough. And I'm not pissed off that the VA wouldn't freaking see me. Like I said, it was my responsibility to get there at 8:30. Not 8:45, not 8:31. It was my responsibility to get out there at 8:30. I'm not really blaming the VA, and I'm not really blaming the doctors. But I want you guys to I want you guys to see it. This is what happens on a single payer health plan. Oh, I don't have any incentive to freaking put a shot in your knee for 3 minutes. I've got 10 other patients that I need to see. So, you want to know what? Screw you. Tell me, show me where a private doctor turns you away. Show me. You're going to have to show me that. Show me where a private doctor turns you away. And if he turns you away, show me your appointment where it's 30 days out. Oh, I can't get you in for another 30 days. Show me. And I guarantee it, you're not going to be able to show me. Because every private industry wants your money. The VA does not make any money. Think about it. Rant over.